Good evening, CAN TV viewers. Thank you for tuning in to the Doty Report on Comprehensive Health. My name is Yolanda Givens, and I am the host for this evening, and we thank you for tuning in. We have some great guests today. As you know, as I talk about every Tuesday, Georgia Doty Comprehensive Health is a nonprofit organization that has been serving the Chicago community for 20 plus years. Really being a health advocate, trying to bridge the gap for some of the health disparities that we know exist in minority communities, being a health advocate, connecting the community with resources, and I always like to give a shout out to the CEO and founder, Mr. Don Doty, and his wife, Ms. Joyce, and just say how we appreciate him for allowing this platform to be in place so that we can inform the community. So I have two guests. 30 minutes is not a lot of time, and they have some great information to share, so we're going to get right into it. As you know, viewers, that you are free to call in and ask questions or even make comments, so we welcome you to do that. So I'm going to start off with this handsome gentleman on my right. Yep, that's my right. Mr. Bill Browne, who is the director for Cook County Veteran Affairs. Is that correct?
That's correct.
And he's going to talk a little bit about, we're going to have some conversation about veteran resources and things that are available to veterans that many may not know about and how to access some of those resources. And to his right, we have the beautiful Dr. Conway. She actually works for the VA as well, but she is the executive director and founder of I Am Able Foundation.
Yes.
That's correct. But she's here today. She's going to talk a little bit about her organization. I definitely want her to share that, but she is going to share information about diabetes and the connection with that with heart disease. Did we talk about? Yeah. So I'm going to get right to it. I'm going to start off. Let me let you both share a little bit about yourself.
Okay. Again, my name is Bill Browne. I'm the Director for Veterans Affairs for Cook County. I've been with Cook County for about 8 years. I'm a veteran myself. I served in the Air Force. I was in Vietnam and in Thailand and had an opportunity to come back and try to help other people in our veteran population out here as well. One of the biggest things that I enjoy with what I do at Cook County is helping other veterans. One of the biggest things I found out when I talk to veterans is they do not know where to go for resources. A very big problem. So my purpose, we were started because President Periwinkle wanted us to start this program. We started it back in 2012. So basically our purpose was to go out, reach out to our veteran population, let them know what's available to them, try to point them in the right direction. It's worked out very well. Many different ways that I do as far as educating and talking to the vets. I get vets that come in off the street. I'm located downtown in the county building, right at 118 North Clark. And they either come in off the street or I get calls from people that are calling in or by way of emails. They call in saying they're looking for resources. They want to find out what's available to them. Where can I go for this? Where can I go for that? And this is where I am here to help them and point them in the right direction.
Okay, we're going to talk a little bit more about that. So Dr. Conway, can you share a little bit about yourself?
Yes, I am a board-certified internist trained in medicine and also in pediatrics, but currently I am an academic hospitalist over the Hines VA Hospital. So I have the pleasure of raising up our future physicians and medical students there. But today I'm coming in capacity of my foundation, which I founded, called I Am Able Foundation, where I'm the founder and the executive director of this nonprofit organization devoted to Chicago's children. And essentially, I started that foundation after the murder of my 15-year-old cousin to Southside gun violence on Mother's Day, when I was actually studying for my boards. And his younger cousin was actually shot 6 months to the day. And when I actually talked with him, I learned from him and other young people that they just simply did not view their brothers as themselves, that there was no connection to other kids, and thus was the inspiration behind the title I Am Able, because we are actually our brother's keeper. Right. And a big part of what we do in terms of our advocacy is not just, violence prevention talks and awareness. We do that. A lot of our young people are certified Red Cross instructors, so they are actually teaching other young people how to save a life rather than to take one. So promoting life consciousness. But in addition to that, the focus of our organization is to raise up our next generation of healthcare heroes, young people who are socially conscious and understand the connection between medicine and society.
I love that. I love that. So, Mr. Browne, I'm going to start with you. I always wonder what is the disconnect. Why, we honor our veterans. They, we are able to live in this country free because of them. They do so much, and then they get out. And so what happens? Like, why is there such a disconnect? It's because I just cannot, for the life of me, understand, at the level that it is. Let me say that. Of course, we know in everything, a few people always fall through the cracks.
Sure.
But at the level that it is, what happens that they don't immediately connect to those services?
Well, I think there's several factors involved in that. I know for myself, when I got out of the service, the only thing I was looking for was when I got off that plane and got back home here, all I was interested in was getting back to getting a job and starting my life all over again. Mm-hmm. But believe it or not, before I got discharged, they do give us some information in terms of what you should be doing or looking for when you do get out of the service. Mm. But a lot of that tends to go over our heads. Mm. So, and I find that to be the case even now. Vets come in or they get discharged and I ask them how long they've been out of the service or where they were at and whatnot, and then that's where we start talking about that they need to find out some resources. One of the things that I think many people do not understand is that depending upon when you served depends upon the type of benefits that you're going to get.
You'll ask that, okay.
Yeah, and people don't understand that sometimes. So myself, I served in Vietnam, and was able to take advantage of the GI Bill and some of the other benefits that are out here. I was able to go back to school, get degrees out there, so that helped me in that regard. Nowadays, when I hear vets coming in talking to me today, they want to know, well, what am I available? What's available to me in terms of benefits? Mm-hmm. So that's where I have to sit down with them and find out, well, when did you serve? How long did you serve? And then from there, I find out what information that they're looking for. And our big thing at my office is I don't have all the answers. Okay. But what I do is I point them in the right direction. Right. I work very closely with the VBA, the Illinois Department of Veterans Affairs. Of course, Cook County, we have a lot of different resources available to our veterans, and then a lot of non-for-profit organizations out here that are geared towards helping our veterans out here.
Absolutely.
So what I do is I interact with these organizations all the time. So as vets come into the office there and they're looking for, let's say, a simple thing like their discharge papers. Mm-hmm. They call it the DD-214. Mm-hmm. Okay? And that, I always tell a veteran, that is one of the most important documents that you have. That is just as important as a Social Security card. Mm-hmm. And a lot of them come in there with a piece of paper that looks like it's shriveled up or is about to be disintegrated or whatnot. Mm-hmm. And I always tell them, well, let me help you out. Okay, we have resources available even at Cook County. Recorder of Deeds, as an example, they will file a veteran's discharge papers free of charge.
Okay.
And all they have to do is they file it, and I always tell the veteran, well, let your family members know where that document is at. Because if something was to happen to you, at least they would know that they can come to the Recorder of Deeds office, bring a copy of your death certificate, and then they can get a copy of it.
Okay.
Okay, so it's a big help. But vets are still learning of that process.
Right. So at the very minimum, all veterans are eligible for something. Yes. Is that correct? Some sort of services, health care, training, regardless of when they serve.
Regardless of when they serve, they have different type of benefits. And of course, unfortunately, if you have some veterans that are dishonorably discharged, then they have a little bit harder time trying to get benefits out here. But most of our veterans out here are either honorably discharged or general discharged, depending on what type of category it is. But I always encourage veterans when they get out, go to the VA office, the VA regional office right there on Taylor Street. Go in there and talk to what we call a veteran service officer. Okay. They are available to help all veterans out there, regardless of when you serve. And the nice thing about the regional office is they can actually pull up your record, find out when you serve, your background and whatnot, and from there they can try to give you more information.
Okay. Okay, so the services are there. I just encourage you viewers that if you are a veteran or if you know of a veteran that is in need of some support, some services, some resources, Mr. Browne is saying go see him. He's saying definitely go see him. Okay, I'm going to move over to Dr. Conway. I know you were going to talk a little bit about diabetes before we even talk about your organization. And the question that I have is, how are you diagnosed?
There are a number of different ways that you can be diagnosed with diabetes, and actually that is a pretty prevalent disease amongst our vet. It mirrors the society as well, but we see quite a bit of it in the veteran population. Couple of things. We can do it if you have a random blood sugar. So say you go into the doctor's office and they check your blood sugar. If you have a random blood sugar that's over 200, that qualifies as being diabetic. You walk in for the very first time and they check your blood sugar and it's 300, you're diabetic, period. That doesn't matter if you're eating, not eating, fasted, not fasted. No one's blood sugar should be randomly 300.
Okay.
So 300 and above, 200 and above, is considered. If we do a fasting blood sugar and it's over 126, that's another criteria for diagnosing.
Okay.
If we do like what we call a carb load, so we give you a certain amount of sugar, this sugary drink that has about 75 grams of sugar, and we check you 2 hours later, if your sugar is more than a certain number, again, you're diagnosed. And finally, a number that we use quite often, it has some limitations, but it's called a hemoglobin A1C or a glycosylated hemoglobin A1C. It will actually look at your blood sugar over a 3-month period. And the numbers have actually gone down in recent years in terms of what they're expecting as normal. So anything now over 6.5 is considered diabetes. Okay. So a number of different ways that you can diagnose the patient.
Okay. So what does it mean? First of all, why are we, I feel like so many people are so terrified. Like, oh my God, I mean, what is that about? Like, where do you think that comes from? I hear people concerned. I've heard, I have myself, where the healthcare provider was like, well, you pre-diabetic. Like, what does that mean? You know? Yeah. And I hear people say that all the time, and it freaks them out. What does that really mean? So
an impaired glucose tolerance is the word that we use. And so if we were to check your hemoglobin A1C, it means that it would be ranging somewhere between 5.7 and 6.5. We have to understand that the problem with the disease of diabetes is it's typically, it's multifactorial, but it's definitely a disease of insulin resistance, type 2 diabetes, the one that affects adults. So there's a period of time where your body is trying to fight against that, and you'll see some signs that might indicate that there's something's going on. For example, there is this thing where you might have dark neck or dark elbows or dark folds. It's called acanthosis. Those kind of things are an indication that there is some improper use of insulin, meaning that your body is trying to overcome the barrier of too much sugar not being filtered properly, and it doesn't know what to do with it, so it's trying to increase. And then the byproducts settle in the skin folds and manifest as acanthosis. So yes, you mentioned a couple things. There is such thing as pre-diabetes, and one of those measures is a hemoglobin A1C between 5.7 and 6.5. But why are we terrified? Because cardiovascular risk when people have diabetes is almost 2 times that of just the general population, all comers. And I think when we look around, particularly even in our veterans population, although there's other cofactors, there's amputations, there's diabetic retinopathy, there's kidney failure, there's increased cardiovascular disease and myocardial infarctions or heart attacks. So, I mean, we definitely know that when diabetes is around, it is a horrific co-conspirator.
Okay.
And for good reason, most people have a healthy respect for it.
Okay. And so is it hereditary?
Diabetes, especially type 2 diabetes, which is the one that most adults will experience, is very much, it has a very strong genetic predilection.
Okay.
And when you look in the family tree, you will oftentimes find tons of people in the family who have it.
Wow. Wow.
Yeah.
Wow. So that's good information.
Super common in black, population as well as Latino and American Indian.
And is it really about we eat, weight? I hear that too. Lose a couple pounds. Eat right. Does that play a role?
Plays a huge role. We know that those are some of the modifiers. It seems like diabetes has an association with everything that has an association with cardiovascular disease.
Okay.
Diabetes seems to have an increased association with obesity, hypercholesterol. It seems the diabetes actually causes secretion of hormones and different types of mediators that actually change the way the blood vessels even behave, increase the likelihood of injury to those blood vessels. And those are the things that are the setup for all of the events that we fear.
Okay.
Yeah.
That's good. Really good.
And yes, actually taking care of the patient and doing some of those things to modify our risk are definitely possible.
Okay. We have a caller. Caller, are you there?
Yes, I am.
You have a question or a comment?
I read a flyer that Mr. Browne and I think a Mr. McGill from the VA hospital got something coming up soon, something about that.
Okay. Yes, he has the flyer with him. Talk to us a little bit about that.
Okay,
Mr.
yeah.
Browne.
There is a program that Georgia Doty Comprehensive Health Program is going to be starting on August 1st. It's going to be at the Kroc Center on the south side of the 1200 West 19th Street. Basically, it's going to be information to talk about veterans, homeless, or veterans who are at risk of homelessness and the health care program. I would encourage you to come out there and to tell your friends to come out there. What we're going to be having out here, at least from the veterans' point of view, is I've invited representatives from the federal VA, the state VA, and non-for-profit organizations, plus myself. We will be out here to help you to answer questions, to help get some answers for you so that we can help you get you pointed in the right direction.
Great. That is great. So that is August 1st. It is going to be 10 to 2 at the Kroc Center in Chicago. And the focus is really on veterans, those that are homeless or in danger of being homeless, that is looking for job training, job opportunities, as well as healthcare resources, as well as a whole other bunch of resources is going to be available that day. So like Mr. Browne says, plan to attend. If you are a veteran, know someone that's a veteran, definitely plan to be there. It is open to the public. It is free. And there's going to be some entertainment and food, and we're going to just have a good time while we're also being able to provide the veterans with some very good information.
That's good.
Yeah. I want to bring the two of you, I want to bring it together. So, we was talking out there about the encouraging young people to go to the military. Mm-hmm. And you, your foundation has a focus on young men.
And women.
And women.
Too. Mm-hmm.
And women. And I hear you talked about the violence, and people always we want to try to get them off the street. Mm-hmm. Is the military an option for that, Mr. Browne?
I think the military is a very good option. I always encourage any young man or any young woman out here who do not know really what they want to do after they get out of high school to go in for 2 years. I mean, don't worry about, I'm going to be sent to Iraq or Afghanistan or some war zone right now. The idea is to go in, get some type of training, because the military, what they will do, they will make you stand on your 2 feet. Mm-hmm. Okay? They give you 3 square meals a day, you get a paycheck, and they will train you on something. Now, I think if you're not really focused in terms of what you want to do, let's go ahead and do it. It's a good idea.
Good idea. So, Dr. Conway, is that something? Is there a possibility like young men going in, and is there any, I guess, medical training? Like, is there a connection between her focus on trying to recruit young men back into the profession of medicine and them being able to gain some discipline in the military?
Well, I can tell you an interesting story. We have a young guy that he has a YouTube presence. He's actually a now orthopedic surgeon, and he actually did that for 8 years. And while he was in the military, he kept telling everybody, "I'm going to be a doctor. I'm going to be a doctor," and nobody believed him because he was just working in the military, doing just the regular things that everybody else was doing, and no one could see that vision but him. But now he's an orthopedic surgeon, being a blessing to a lot of young people. Actually, one of my mentees is actually now Captain Valyn Anton is her name, and she's actually in her second year of emergency medicine. She went through the United States Army, and she actually used it on the back end. She graduated, went to medical school, and when she went to medical school, she also joined the Army. So there's a lot of different benefits, I think, for a lot of people, and it's just wonderful to see people with the kind of talents that she has applying it in that arena.
Right, that is good. But I heard you say you can go for only 2 years.
Well, you can go for longer if you want.
But I'm saying is that
I just said that's a minimum if a person was going for 2 years.
I didn't know that.
That's good to know, really.
Yeah, no, that is very good. 'Cause I thought it was at least 4, but that is good that you can
well, it
actually.
depends upon when you went in. Like I went to the Air Force, so
Okay.
of course
That's
so I was
cool.
committed for 4 years.
Okay.
But the Army is differently. They have them for 2 years.
Wow.
But one thing I want to share, though, also in addition to having vets coming into the office out there, we also work with them in terms of helping to find jobs. That's one of the things I get people coming in. They say, "Where can I find a job?" Or "How do I get doing this?" Or "How do I do that?" So what we do is I have a database where vets come in. I usually get their email address, some information from them, and I'll send out job listings to them in terms of what's available to them out there. I leave it up to them to decide what they want to go after. But there are resources out there. There's non-for-profit organizations out here that National Able, as an example, is one. They have resources out here.
Right.
One of our own within Cook County is the Chicago Cook Workforce Partnership.
Okay.
They are available to do that. So I always tell veterans, if you're looking for something, we come, we will help you out.
Right.
Just depending on what you want to do.
Right.
But also the other thing that I always stress with vets, you have to take the initiative to find out what's available to you.
Right, absolutely.
We're not going to go out there and find out where you're at.
Right.
I'm always really even surprised at the number of veterans who come in that didn't even, this might sound crazy, that didn't know that they can come to the hospital. I'm not even kidding you.
Wow.
We take care of, especially some of our younger vets who didn't really see themselves as patients, and then they became ill. I've heard that more than a number of times, and I'm always amazed at the amount of services that are available to veterans that veterans seem to not know about.
Yeah, that's what
It really makes me sad because we do have a lot.
Wow. So there are tons, I can't stress, tons of resources available for our veterans. We just have to be able to spread that word and get the message out. We only have 5 minutes, so I wanted to give both of you an opportunity to just share, starting with you, Mr. Browne, your final thoughts, and leaving a couple of minutes for Dr. Conway to be able to share hers.
Okay, a couple of minutes. But one of the other things I would like to suggest also is a veteran join a service organization. American Legion, VFW, DAV. There's a lot of different organizations out there because it's a way of vets being able to connect with other veterans out here and to talk to veterans. A lot of vets don't want to talk to somebody who's not a veteran.
Right.
So
right. I've heard that.
So I always encourage them, join some service organization and just see what it's like. There's so many of them out here around, just take advantage of it and see what's available to them. One of the things I like to leave with the conversation here today is I would encourage any veteran that's out there, please, you can come by my office. I'm in the county building at 118 North Clark up on the 8th floor. You can give me a call. You can send me your email address with my information, and I will be glad to help you out. One of the things by working with Cook County is a very large county. We have 17 different districts. So I get a chance to interact with all of the various commissioners here at Cook County and go out into the field and talk to different people. As an example here, when I got a chance to meet Mr. Doty, and he told me about this program that he wanted to start to reach out to veterans out here, I said, well, great. So this is what I do is I bring in resources, the experts to kind of come out, talk to the veterans, and believe it or not, the vets appreciate it. They say, oh, I didn't know this. Well, thank you for sharing this with me. So this is something that I like to leave with the veterans out here. Don't stand around waiting for someone to come to you. Go out and find out what resources. I'm available downtown in Cook County. The state has a building right there across the street from me at 69 West Washington, and I would encourage all of our vets, go by the VA regional office at 2122 West Taylor is there for you. Take advantage of it. Find out what's available to you. Ask some questions so that you can get some help.
That's right. No excuse. No excuse.
That's right.
Dr. Conway, what are your final words for us?
Final thoughts are that, in the year 2025 and 2030, we're actually going to experience a shortage of physicians like the United States has not experienced. The hardest hit communities are going to be those that are from vulnerable populations. For that reason, so we talk about health inequities, but there's also a lot of health inequity because we don't have the actual personnel or the staff that cares enough to go back into these communities. That is the reason why we're raising up socially conscious young people who are going to be our next generation of healthcare heroes. So if you know any young people that are bright, that are from the inner city or even in the suburbs, who really have an interest, at least in medicine, please have them go check out the website, www.iamable. We have over 100 plus physician mentors that are mentoring one-to-one these young kids of color, African American, Latino, and some kids are not. They're just socioeconomically disadvantaged,
Right.
Indian and Caucasian even. But our focus has always been on those who have been left behind.
Right.
So if you are out there and you're listening and you have a young person that's in high school, college, or in the post-bac area and they want to become a doctor or explore at least that option, it's a very intense pre-med curriculum because we're not playing with them because they're not going to get into medical school unless they are really nurtured and taught the right way.
Right.
And that's what we're about.
Man, I love that.
Send them our way.
Whoa, I love that.
We're already seeing them get in already, so it's been a short time, but we are getting kids into medical school.
Wow, I love that, and I love that healthcare heroes. I'm definitely going to remember that. So I just want to thank our guests. It was a very short time, but
Goes fast, like you said.
yeah, but it was some really, really great information. You guys know I'm always intrigued because I'm learning so much. But I just want to thank the viewers for tuning in once again. Next week will be our last show for the quarter, and we hope that you heard something that could possibly impact or make a difference, or something that you can share. I always tell you to find me, Yolanda Gibbons, on Facebook, because tomorrow I will be posting their information. I'll be doing a recap because we really want to be able to provide the community with all of these resources that we often, especially in minority communities, for whatever reason, it just seems to bypass us,
Yes,
but
so
having like that mentorship and someone like Mr. Browne is saying, come to him, his office, him directly. He has an open door policy, I just love it. I love it, and it is so. I appreciate having people, professionals like yourselves, that come and just share that you are available. You're not beyond giving back to the community and really wanting to help. And our communities, our young people, our young men and women definitely need that. So I definitely want to say I appreciate it, and I'm sure Georgia Doty, Mr. Don Doty appreciate it as well. Thank you again for tuning in. Meet me back here next Tuesday at 7:30 for our final show for this quarter, and have a great rest of the week. Thank you so much.
Thank you.
Bye.